Now we're going to sort of drill down and look at details inside each of those. I sort of look at this as building the circulatory system. All right, so we spent a lot of time talking about the heart. Now let's talk a little bit more about vessels. Vessels are pipes. You can think of them as pipes. They're very intelligent pipes because they can heal themselves and they have very low resistance, but they are in fact pipes. So when we look at a pipe, physics tells us that flow is pressure gradient over resistance. Okay, so you have a pressure on one end, you have a pressure on the other end. If the pressures are different, blood will flow, right? If the pressure of one is greater than 2, then there's going to be a hydrostatic force pushing blood out the other end. So we'll have blood flow of this way. Now resistance, everything that moves in the universe is resisted by something. Okay, when fluid moves through a pipe, there are a number of things that resist that flow. The walls of the pipe resist the flow, and then the inertia of the fluid also resists that flow. Okay, so resistance is how much pressure is lost between 1 and 2. In other words, how much pressure did you have to spend to overcome the resistance of the pipe and actually get blood to flow out the other end. There are a number of things that affect resistance, and this is all right out of physics. And interestingly, it's the exact same relationships we see in electricity. Okay, so if you remember Ohm's law and stuff, same application, it's just this is water in a pipe instead. Okay, length. The longer the tube, the greater the resistance. Classic example here is, you're a little kid, you're playing with drinking straws. Anybody put multiple drinking straws together and then try to drink out of it? Super hard, right? You're going to cave in your forehead doing that kind of thing. Well, that is because the longer the tube, the greater the resistance, right? So there's more resistance to your big toe than there is to your shoulder, for example. Okay, so that's length. Smoothness, how smooth the pipes are, is a variable. Now, if we remember, physiology is all about the normal. We assume that our pipes are nice and smooth, right? Our vessels are smooth, the endothelial cells are healthy. Now, as in pathology, that can start to break down. So like in coronary artery disease, for example, when you get an atheroma, plaque in the vessel, it reduces the smoothness and therefore increases the resistance. But typically, smoothness is a factor in our bodies. It doesn't change very much. Viscosity, that has to do with what's flowing through the pipe. If you're pushing corn syrup through the pipe, it's going to take more pressure to do that than pushing alcohol through the pipe, right? Because viscosity. Blood viscosity does change, but it doesn't change rapidly. It doesn't change in minutes to hours, it changes in hours to days. So typically viscosity doesn't change very much, but it is a player in resistance. And then number of branches, irregularities. The lowest resistance pipe is one that's nice and smooth with no branches. That's not our arterial system, right? Got a lot of branches. The more branches you have in an area, the more resistance to blood flow there is because of turbulence, right? You can think of it, it's the same processes that happen in our morning commutes, right? When you're on the side streets, there's lots of little corners, everybody's turning every which way, so you get a lot of turbulent flow. Once you get on the highway, you got everybody going in the same direction, you get laminar flow, right? So those things, laminar flow has lower resistance than turbulent flow does. All right, and then to make things move, you need to have a pressure gradient. In other words, a difference between one side and the other. Okay, so resistance and flow, those are the big characteristics. Now, I'll give you a little spoiler. Our bodies affect resistance most by affecting the diameter of vessels. Okay, so all of those things affect vessels. Length, smoothness, viscosity, and number of branches all affect resistance. The thing that affects it most in our bodies is vessel size, diameter, which isn't on the list, but that's because it's coming. Okay. Okay, so smooth Laminar flow versus turbulent flow in a picture. Okay, so this is what you want. B is what you want, where the blood is flowing in nice even lines. It isn't bumping into each other. This is nice, smooth flow. The more the vessel wall is not smooth, or the more branches and bends there are, the more turbulence there is. In some parts of our body, turbulence is quite extreme. In the first part of the aorta and the first part of the pulmonary artery, that's where you get the most turbulent flow. Because you've got the heart is squeezing out with all of its force at very high pressure, right? We're crossing a valve, so you got a lot of nooks and crannies. And then you're pushing all that blood into a relatively small vessel. So sometimes we can even hear that ejection when we listen to folks, particularly children. We'll call that an ejection murmur. But these are all, so turbulence has a tendency to increase resistance. This is the most important way we control resistance. Because all of those things, vessel length, viscosity, vessel smoothness, and number and amount of turbulence, very important characteristics that don't change very much, right? We're not growing new blood vessels all the time, not once we're adults. Our blood viscosity doesn't change very much because while our diets change, we are carefully regulating that. Vessel length, your vessels aren't getting like longer or shorter every day, okay? So all of those characteristics, while important, they don't change. So we can sort of put them all into the category of, these are factors, but because they don't change, we don't have to worry about them. What does change is vessel diameter. Okay, so this is vasoconstriction and vasodilation. The physics says that as the diameter of the pipe increases, resistance decreases. And not in a linear relationship, in a geometric one, by factor of 4. Okay, so it means if we go from diameter 1 to diameter 2, we increase our blood flow by 16-fold. Okay, and if we go from 2 to 4, we get another 16-fold. So what that is saying is a small change in diameter makes a big change in resistance, a big reduction in resistance. Reduce the resistance, increase the flow. This is how our bodies control capillary beds, by getting smaller, by having the vessels get smaller to reduce the flow, larger to increase the flow through an individual capillary. Now the cool thing is each one of our arterioles can do this trick all by itself. So we have lots and lots of valves that are all changing size to control the amount of blood that's flowing through the capillaries, right? So arterioles do this trick the best. All arteries can do this trick though. Even the aorta can vasoconstrict a little. The muscular arteries, the medium-sized arteries, are particularly good at this too. And then the arterioles are the best at it. Like they can change their diameter by like a factor of 16. So they can really get much bigger or much smaller. So when we talk about total peripheral resistance, we're not talking about this at one vessel. Okay, we're talking about this happening at all the vessels. Okay, so like if you go outside and it's minus 30 degrees outside, okay, so very, very cold. Well, all of your vessels are going to constrict, the vessels to your skin anyway, are all going to constrict so that you conserve your heat, right? Well, if all the vessels to your skin constrict, what will that do to your total peripheral resistance? Up or down? Up, right? Because if you've got a lot of vessels constricting, you're increasing the resistance in the whole body. And that's true. On a cold winter day, when you're in full heat containment mode, your blood pressure will be elevated, right? Because your total peripheral resistance will be elevated. Now, if you were to somehow stay out there for long periods of time, it would adjust. But at least at first, it would be significantly elevated. So big Big changes in flow for small changes in volume.